This DVD was produced by the Oral Hygiene Committee of the Taiwan Dental Association. Flossing and brushing. All kinds of delicious foods have come with our raised standard of living. However, good oral hygiene does not follow good meals. Consequently, cavities and periodontal disease occur and bring us trouble because germs grow rapidly in the oral cavity. Actually, our teeth can last our entire lifetime by utilizing oral hygiene concepts in daily flossing and brushing. Making plaque visible. Dental plaque is the accumulation of germs on the tooth surface adjacent to the gums. Usually, they are difficult to see with the naked eyes. A staining agent soaked in a cotton tip is applied to the junction of the teeth and gums. Then the excessive agent is rinsed off one time. The stained plaque is then easier to detect. It usually occurs at the tooth surface near the gums. The dentist will use a cow horn explorer to scrape the dark stained area. If there is sticky soft stuff on the tip, it is dental plaque. A toothbrush just passes over convex tooth surfaces and misses the inward surfaces between the teeth and gums. This is inaccessible to the toothbrush and needs to be flossed to reach. Dental plaque is the main cause of gum disease and cavities. Flossing and brushing are the most important way to ensure good oral hygiene. You should do this twice a day, once in the morning before you leave home, and once before you retire each night. Of course, everyone can do this at their own convenience. It's best to floss and brush your teeth in front of a mirror to make sure you are doing it the right way in the right places. Spool method of flossing. To make it easier to see, we are using black floss to demonstrate flossing. The proper length would be from your hand to your shoulder. Wrap one end of the floss around the second knuckle of your middle finger 2 times. It is loose at this time, so hold the floss with your thumb. Wrap the floss with a length of approximately 20 centimeters between one middle finger and the other middle finger, also winding twice around the second middle finger. Fold the middle fingers, ring fingers, and little fingers of both hands into your palms. This helps to keep the floss tight around the middle fingers. Then stretch your thumbs and index fingers, keeping the 2 thumbs together. Keep the index fingers at an angle of 90 degrees to the thumbs. This is the basic position for holding floss. Then, lift the left thumb up and stretch the floss. Use the right index fingers to stretch the floss. Keep the 2 fingers about 1 centimeter apart. Let the soiled floss pass from the middle finger and pull in clean floss on the other middle finger so that you have clean floss to use. Keep the floss against one side of the tooth and bring it up into the gum until it meets a natural resistance. Press the floss tightly against one side of the tooth surface and scrape it using up and down strokes until you hear a squeaking sound. That means the surface is clean. After cleaning one side of a tooth, clean the adjacent surface of the next tooth, then scrape the other side. Make sure that the floss is pressed tightly against the tooth surface on both the in and the outside so that the floss has a C shape. Start flossing from the easier side, like the upper front teeth. Then floss toward the back space by space. You have to stretch and flatten out both the upper and lower lips to seat and guide the floss better. When you are working on the cheek side, if you tilt your head slightly back, you can see those inside spaces better. Keep the floss between 2 fingers as short as 1 centimeter. Use 1 thumb and 1 index finger. In order to position the floss at the right angle to floss the lower front teeth, raise the elbow up to a 90-degree angle such that the index finger points down at the tongue tip naturally. On the front section of teeth, use the right thumb for the right side of the teeth and the left thumb for the left side of the teeth. For the back teeth, only 2 index fingers are used. Extend both index fingers and stretch the cheek out at the same time to see better. For the lower teeth, bring the chin down to make them easier to see. Common errors when flossing. The fingers will get strangled if the floss is wrapped around them tightly and too many times. The correct way: 2 turns is adequate. When the hand is folded into a fist, the finger will stretch and hold the floss tightly. If the floss is too long between 2 fingers, it could cut the corner of the mouth. If the floss is too short between 2 fingers, both hands will be pulled into the mouth. The correct way: resume the basic gesture for holding floss. Make sure to stretch your 2 thumbs and touch them only lightly. You're unable to see the gums or teeth if you close your mouth when flossing. The correct way: stretch and flatten out the upper and lower lips. Cross-handed. Using the left thumb for the right front teeth, or using the right thumb for the left front teeth. The correct way: use the thumb on the same side as the teeth. Thumb goes into mouth. This is awkward. The correct way: as the thumb is short, it should be kept outside of the oral cavity. Only the index finger goes into the oral cavity. Floss slant vertically. The side of the teeth next to the tongue will not get flossed. The correct way: keep 2 fingers only 1 centimeter apart. Since floss doesn't move on the side next to the tongue, that side will not get cleaned. The correct way: on inner and outer sides of the teeth, the floss should move up and down together. It helps to keep the floss between 2 fingers at a length of only 1 centimeter. Flossing the teeth at a cross angle may hurt the gums, and some areas of the tooth surface may not get clean. The correct way: press floss tightly against the side surface of the tooth. Bass method of brushing. Soft and small toothbrushes are recommended. Holding the toothbrush, perfect. The key points of Bass' method of toothbrushing. 1. Placement of the brush. Brush bristles should be angled slightly toward the teeth. Place the brush at the junction of the teeth and gums to ensure that tooth surfaces are completely covered. Press the brush slightly against the teeth so it is at an angle of 45 to 60 degrees to the teeth, with the bristles angled downward for the lower teeth. 2. Brush strokes. Make 10 horizontal or vibrating strokes covering 2 teeth. Brushing sequence. Start from the upper right far back teeth and slowly brush to the teeth at the right corner of the mouth using the Bass method. To see the teeth and brushing action better, tilt your head upward and slightly to your left and use the handle of the brush to pull the cheek outward. Turn the brush toward your left side and stretch your lips open to get the best view. Brush the teeth around to the left corner of the mouth. After brushing the teeth around to the left corner of the mouth, your right hand will block your view, so we recommend using the left hand. Brush the biting surfaces starting from the far back teeth gradually up to the canine. To see better, tilt your head upward and slightly to your left side. Place the brush against the inside surface next to the tongue, with the handle touching the front teeth. At this time, the handle will be on your right side, so use your right hand to hold the brush. Turn the brush to the right so that the handle touches the right corner of the mouth. This will allow the brush to have full contact with the tooth surfaces. Tilt your head upward and slightly to your right side, and use your left hand to hold the brush for the right back teeth. Brush the biting surfaces from the far back teeth gradually up to the canine. By using this sequence, you won't miss any teeth. Point the brush downward. Otherwise, use the same principles for the lower teeth. Start from the outer surfaces of the right back teeth and gradually move to the teeth around the right corner of the mouth. For the outer surfaces of the lower left teeth, try using the left hand to improve access. Place the brush against the inner surfaces with the handle touching the front teeth. Brush back and forth with short strokes from the far back teeth gradually up to the canine. Inner surfaces and finish up on the biting surfaces of the right back teeth. Common brushing errors. Some brushes are just too big to reach the back teeth or difficult areas. The correct way? Use a small brush that can fit into the area between the inside space between the lower teeth and the tongue. Using a brush that's too hard will eventually damage the teeth. The correct way? Select a brush with soft bristles. Children's brushes are a good choice. Same as using a hard brush, overly vigorous brushing will hurt the teeth and damage the gums eventually. The correct way? Use short strokes or vibrating strokes to prevent excessive abrasion to the teeth. Holding the brush at an angle like this reduces the brushing efficiency. The correct way? The brush should always be aligned with the teeth. If you brush like this, you will miss some areas. The correct way? Hold the brush horizontally in line with the teeth. The brush will miss the tooth surfaces adjacent to the gum. This will also ruin the brush. The correct way? Place the brush on the side of the teeth at an angle of 45 to 60 degrees. It is easy to miss some difficult areas, like many right-handed people miss the left surface of the upper back teeth. The correct way? Follow a fixed and complete sequence, like starting from the right side and ending on the right side in a closed circle sequence. Flossing is more important than brushing for cleaning the neighboring surfaces in between two teeth. Unfortunately, most people brush without flossing. The correct way? Floss before you brush. The new habit of flossing should be done before the old habit of brushing. This will help to establish a new habit. Alternative methods of oral hygiene. Interdental brushes. Interdental brushes are only good for enlarged spaces between teeth. For the best cleaning, select the biggest size of brush that can fit into the space and snugly touch the neighboring surfaces. Therefore, a cone-shaped brush is the best choice. People tend to brush outside in, but brushing inside out is also necessary. Floss threaders. Under the dental bridge or braces, interdental brushes are very helpful. Additionally, we can use floss threaders to thread the floss through the under spaces so that we can then floss in those spaces. Good oral hygiene will improve your health, as well as give you a better quality of life. And sex appeal. Thank you.